Good day everyone, in another video from Let's Talk Medicine presented by me, Ro'a Amir. So we are going to talk today about meningitis. This is the outline that we are going to talk about today. So we will talk about definition, routes of transmission, types of meningitis. We are going to focus more about the bacterial or the acute pyogenic meningitis. Then we will touch upon the other types of meningitis. Then we will go to the diagnosis, treatment and complications, and finally we will go to discuss the prophylaxis. So let's get started. So let's start with our first objective for today, which is the definitions. So four terms we have to differentiate between them. Let's start first with meningitis. So meningitis is basically inflammation of the meninges or the membranes that are covering the brain parenchyma or the brain itself. Meninges is or meningitis is classified into two types, leptomeninges, okay, and the pachymeninges. Conventionally, when we talk about meningitis, we usually talk about the leptomeninges, but because this is the most common type, because it's an inflammation of the pia, arachnoid, and CSF. However, pachymeninges is rare, and it's inflammation of the dura mater only. Okay. Another term we have in here is encephalitis. What's the common between meningitis and encephalitis? Both of them are diffuse inflammation. So they are diffuse inflammation, both of them. However, the encephalitis is inflammation of the brain parenchyma itself, which is the brain tissue. Now, cerebral abscess and cerebritis, both of them are localized inflammations, okay? However, in the cerebritis, we have it here without a capsule, so there is no capsule, okay? And for the cerebral abscess, we have an encapsulated inflammation. So encapsulated inflammation. Moving to the causes of meningitis. So basically meningitis causes can be classified into infectious causes, and this is the most common, and we have the non-infectious causes. The infectious causes we are going to concentrate more on this video, especially the bacterial types. The other type, which is the non-infectious, that can be malignancy, for example, like some types of leukemias and lymphomas and breast cancer, for example. Autoimmune diseases like systemic lupus erythematosus, SLE, and some chemicals also can cause irritation to the meninges, causing meningitis, for example, non-steroidal anti-inflammatory drugs. This is just an overview table showing you the different types of meningitis, the bacterial as part of the infectious, and we have the non-infectious causes in this. For example, in the bacterial, we have the different organisms that can cause it upon the different age groups. The most important thing I want you to know from this slide, because we are going to talk in details about the bacterial meningitis in the upcoming slides, just an important thing I want you to know that strep pneumoniae is the most common cause of bacterial meningitis, and specifically viral meningitis is considered the most common type of infectious meningitis, and in general most common cause of meningitis. And of that, the most common organism that can cause it is the enteroviruses family, that include the Coxsackie virus, the echovirus, and poliovirus. And another one can cause also viral meningitis is herpes simplex virus, and this is really important and very high yield for you to know, because HSV meningitis is very severe and they might have symptoms that are very similar to the bacterial meningitis. So you have to differentiate between them. And we will come upon this in the management plan. Another thing I want you to know about the herpes simplex virus, that it's very common in close contact areas or populations. That's why it's common among the college students in dorm, and this can be as a hint in the question. So as we said, the most common cause of meningitis is going to be viral meningitis, and the most common organism causing it is the enteroviruses. Other causes of infectious meningitis can be fungal, protozoan, and parasitic. Those are common among the immunocompromised patients like AIDS patients and diabetics, and some patients who are in contact with cat feces and they are immunocompromised as pregnant women. So it's really important to take history of immunity. Other causes, we have the malignant causes and the inflammatory causes as non-infectious meningitis. And as we said and mentioned in the previous slides, we have SLE, we have breast cancer, non-steroidal anti-inflammatory drugs can also cause some sort of meningitis. This is another classification of meningitis. Just to make it easier, we have different types of meningitis. We have the acute pyogenic meningitis of the infectious causes, aseptic viral meningitis, and we have the chronic meningitis. Acute pyogenic meningitis, we are going to talk about it in details. The aseptic meningitis, as we mentioned before in the viruses, we have the enteroviruses and HSV. What I want to talk about in this slide is the chronic type of meningitis that can be caused by TB, meningitis that can be caused also by spirochetes and cryptococcal meningitis. Those are some sort of the chronic type of meningitis. So as we know, the CNS is a very important area in the body that is protected by different layers, the pia, the arachnoid, the CSF, and we have the dura mater. So how can any organism, viral, bacterial, or fungal, or any parasite can reach into the CNS? So we have different routes for transmission. However, the most important one is the hematogenous route, because most of the organisms take this route as to invade the CNS system. So we will go upon each one now. For example, we have the direct implantation as a first way of transmission. So for example, we have the traumatic injuries like skull fractures can cause direct inoculation of the organisms. Also, we have the congenital malformation. For example, as you can see in here in this picture, we have the congenital myelomeningocele. So for example, this can also cause a direct implantation of the organism. Other neighboring structure, for example, the sinusitis can cause also a sinusitis infection with strep pneumoniae and Neisseria meningitidis can cause bacterial meningitis. Also, otitis media and different sites of infection in the face, like teeth abscess and osteomyelitis of the temporal bone, can also cause the transmission of the organism, causing meningitis. Now we come to the most important one, as we said, is the hematogenous route. So majority of the organism, they originate in the nasopharynx, okay, in the area of the nasopharynx, and spread through the hematogenous route, either arterial or retrograde venous. So the arterial can come from pneumonia, bronchiectasis, infective endocarditis, or it can be retrograde venous, as in the danger triangle in the face, as we said, the oropharynx. And this is the most common. Another route that can organism reach to the CNS is a retrograde from the peripheral nervous system, as in the herpes simplex virus, okay, that can cause viral meningitis, and we have the rabies also, and we have the final route of transmission, which is iatrogenic or induced by us doctors. So it can be through LP, which is lumbar puncture, or can be due to ventriculoperitoneal shunting, and those people usually have low recurrent or chronic type of meningitis. So now we are going to talk in details about the acute pyogenic meningitis, which is also called the bacterial meningitis. So bacterial meningitis in general is classified according to the age group of the patient. So we have neonates, which are 1 month old, infants, and we have children and young adults, elderly, and we will talk finally about some specific populations like the immunocompromised patients, for example. So now we will start to mention the most common organism that can cause bacterial meningitis in each age group. So we will start with the first age group, which is neonates, which are 1 month old. So it's really important to know these three organisms, because they are the same ones that can cause neonatal sepsis in those patients. So it's really important to identify them, because any bacterial meningitis, as we are going to mention later, it can present with septic shock, and the patient can go into death rapidly. So 3 important organisms you should know. So first of all, we have the group B, streptococcal infection, okay, and we have, as in here, the E for E. coli, okay, or Escherichia coli, and then we have the L in here for Listeria monocytogenes, okay. All of them are infecting the vaginal canal. The group B streptococcal, they are acquired from the birth canal itself, and as we know, the other name for group B streptococcal is Streptococcal agalacti. E. coli is acquired from the perineum, so it can contaminate also the birth canal. Listeria monocytogenes, it's acquired by the mother, ingestion of the raw milk or unpasteurized milk and cheese, and eating deli meat like hot dogs and salamis that are infected with Listeria monocytogenes. So it will travel and inoculate in the vaginal canal, and then it will infect the baby during the delivery. So the mnemonics for neonatal meningitis, bacteria meningitis, is going to be Bell. Okay, it's really important to know these three organisms. Now coming to the most important three organisms that can cause bacteria meningitis in the infants age group. So we have Haemophilus influenza, we have strep pneumoniae, and Neisseria meningitidis. Nowadays we don't see that much of Haemophilus influenza meningitis because of the vaccine, so it was previously common, not nowadays. Second is the strep pneumoniae, as we said and mentioned before. It's the most common cause of bacterial meningitis in general. However, as we mentioned, the most common cause of meningitis in general, all of the types, is the viral meningitis, which is an infectious type. Then we come to the third organism, which is the Neisseria meningitidis. Neisseria meningitidis is very important to know that, as we know from the microbiology classes, that Neisseria meningitidis is a gram-negative diplococci. So usually when we come in the diagnosis and the gram staining of the CSF or blood, they usually put a primary report and they say we see gram-negative diplococci. So when you see that, you have to start treatment immediately as soon as possible, because the patient can go rapidly into septic shock and death. So another thing you should know about Neisseria meningitidis, it's common in people who live in close quarters and very close areas. It can also present as a petechial rash, and I will show you a picture about this later. A very characteristic rash when you see it with fever and the context of other symptoms of meningitis. As we said, you have to start the treatment promptly. As for the young adults, they also have the most common as Neisseria meningitidis, and also sometimes they have the strep pneumoniae, but the most important one is the Neisseria meningitidis organism, which is gram-negative diplococci. Now coming to the elderly age group, the most common organism that can cause bacterial meningitis is strep pneumoniae, and as we said, it's the most common cause of bacterial meningitis in general. And another thing, they are more prone to have the Listeria monocytogenes infection. And what we define as old adult or elderly in meningitis, people who are above 50-year-old. So above 50, you have to suspect those two organisms, and according to that, when we come to the management plan, we are going to tailor the antibiotic therapy according to that. Finally, as you can see here, we have different populations that are more prone for specific organisms. For example, as a pregnant woman, we said that they have to be careful about the Listeria monocytogenes because it can be from the unpasteurized milk and ingestion of the deli meat, for example. So they have to be careful about this. Another population is the alcoholic patients, which are more prone for strep pneumoniae infections. Finally, we have the immunocompromised patients, and this is a very important category that you should know. For example, in AIDS patients and diabetic patients, they are more prone to have some of these organisms like Pseudomonas aeruginosa, Mycobacterium tuberculosis, and Mycobacterium avium, with the other strep pneumoniae and Listeria monocytogenes. This is just a table summarizing the different age groups with the most important and the most relevant organisms that can cause bacterial meningitis. This is another table summarizing the different special populations that we are talking about, like pregnancies and immunocompromised patients and head trauma. What I want you to emphasize on in here, there is an important high-yield information. For patients with head trauma and post-neurosurgery, they are more prone to have Staph aureus infection and coagulase negative Staphylococcus organisms. For example, the Staph epidermidis, okay, they are more prone for it, okay, and we have the gram-negative aerobic, for example, the Pseudomonas aeruginosa, okay. So 3 different organisms that are more common in head trauma and post-neurosurgery: Staph aureus, Staph epidermidis, and Pseudomonas. Now coming to the pathophysiology of bacterial meningitis or acute pyogenic meningitis. So three important steps in general that happens in the pathophysiology. So number one is the invasion of the organism into the body. So entry of the bacterial organism into the body and colonization. This is the first step. Second step is migration and proliferation, okay? And then we have initiation of the immune response. Then we have the actual presentation of meningitis. So three important steps to have the pathophysiology of meningitis. So this is just an illustrating picture showing the different phases of pathophysiology of acute pyogenic meningitis. So as you can see in here, we have the teeny tiny organisms in here. So those organisms will go into the upper respiratory tract and infected. Different organisms have different routes. For example, we have the Neisseria meningitis. They attach through fimbria and then they go transcellularly. We have some other organisms that go intercellularly, like Haemophilus influenza, and we have also the strep pneumoniae that secrete the IgA proteases to destroy the mucosa and then invade into the body. After that, they go into the hematogenous route or the vessels, and then they go there and proliferate and migrate, and from that they migrate into the CNS through the cerebral vessels. So we have here the cerebral vessels, okay, and we have also the choroidal vessels. So this should be in here going to the cerebrum, and then we have the choroidal vessels. So choroidal vessels. Okay, so two routes through the cerebral vessels and choroidal vessels. As we mentioned, the hematogenous route is the most common route or transmission for a way of transmission of organisms. So after that, it will go into the, through that, it will go into the system, the ventricular system, okay, and proliferate and in there. And then it will go through foramen of Mengendii and foramen of Flushka going into the subarachnoid space. Okay, and going into the whole subarachnoid space and filling the CSF with this inflammation, and this inflammation will give us the definition of meningitis, which is the diffuse inflammation of the meninges, as we say, the pia mater and the arachnoid space with the CSF. Okay, so what immunological responses we have against that? As we know, most of the organisms that cause meningitis are encapsulated, like Neisseria meningitidis and Haemophilus influenza and strep pneumonia. They are, most of them are encapsulated. So they are antiphagocytic material. That's why it's not phagocytosed by the immune system in the vessels. However, when they reach into the CNS, they start giving some cytokines and chemokines. For example, we have the IL-1, interleukin-1, and we have tumor necrosis factor. We have increase in the glutamate activity, and because of that, we have sometimes seen some seizures and episodes of seizures with the meningitis as presentation because of the glutamate. And we also have increase in the nitric oxide production. That's why we have vasodilation, and that's why we have leakage of the proteins into the subarachnoid space. We have also the increase in the oxygen reactive species. So all of that can cause the different presentation of meningitis. So that summarizes the pathophysiology of bacterial meningitis in here. Now, going to the risk factors that can predispose to meningitis or bacterial meningitis, we have immunosuppression or immunocompromised patients in general. They are more predisposed to have meningitis. Also some cancers, and we have also otitis media. They can be prone and predisposed to meningitis. We have also sinusitis as an example. Bacterial sinusitis, they are more prone to have those patients, they are more prone to have staph pneumonia infections and Neisseria meningitidis meningitis. We also have the age extremes like neonates and elderly, because those, they do not usually present with the classical symptoms or presentation of meningitis, so you have to keep an eye on them. Also, we have head trauma and osteomyelitis. Also, alcoholic patients, they are more prone for meningitis. Bacteremia patients and systemic infections, they can be also prone to meningitis. And we have here the neurosurgical procedures, as we mentioned before, like the LP, lumbar puncture, and ventricular peritoneal shunting can induce the or inoculate the organism directly into the CNS, so that can cause meningitis. People with splenectomy, they are very important to identify them, like sickle cell disease and thalassemia patients. They usually have splenectomy or autosplenectomy. That's why they are more prone to have infections with encapsulated organisms. For example, they are more prone to have strep pneumonia, meningitis. That's why you have to really know those population of patients. Now, going to the clinical presentation of meningitis, which is summarized in those three symptom or triad, which is fever, mental status changes, and neck stiffness. And you should know that the other name for neck stiffness is meningismus. So meningismus, okay, and you have to differentiate it from the upcoming slide, which is talking about meningism. So three symptoms: fever, neck stiffness or meningismus, and mental status changes. This is the triad for meningitis. Another thing you should know that viral meningitis, they have less prominent meningitic signs or symptoms. So they usually complain of meningismus and headache, and they don't usually have fever in the case of viral meningitis. Another thing you should know that people who are in the age group of neonates, okay, and also elderly, they don't usually present with this triad, that because they cannot sometimes express the symptoms. So they usually have poor feeding, irritability, and agitation, and they sometimes have lethargy and confusion. So because of that, they don't usually present as the classical features of meningitis. Finally, you should know that any bacterial meningitis, you should put in your mind that it can develop to acute septic shock at any time. So you have to prompt the treatment as soon as possible, and we will come to the treatment of bacterial meningitis at the end of this lecture. Now, going to the term meningism. So when they refer or say the patient have the meningism features, so meningism is usually headache, okay, a triad of headache, photophobia, and nuchal rigidity, and we will explain each one of them. So with meningitis and the vasodilation and increased vascular permeability, you will have increased intracranial pressure. And because of this increased intracranial pressure, this will cause the headache and will also cause the photophobia. So what is a photophobia? Photophobia is basically pain or discomfort that is associated with light. So this is because of the third cranial nerve. Okay, so this is because of the third cranial nerve, the oculomotor nerve. The normal function of it is dilation and constriction of the pupil according to the amount of light coming into the pupil. So when we have the increased intracranial pressure, this will compress on the third cranial nerve, and then it will cause dysfunction. Therefore, the patient will have photophobia. And finally, we will have the nuchal rigidity, which is basically decreased ability to move the neck and increased rigidity of the neck muscles. And how do you differentiate it, or how can you differentiate it for example, neck rigidity because of cervical spine osteoarthritis? Well, nuchal rigidity in meningitis is basically restriction of the movement of the neck in the flexion. So specifically in the flexion area, or when you try to get the chin of the patient into the chest, this will be very difficult. However, in the cervical spine osteoarthritis, you will notice that all of the movements of the neck will be restricted. Left, right, up or down, or flexion or extension will be restricted.